Hello, everybody. Dr. Karlfeldt. I just wanted, this is one of the therapies that I do a lot at the Karlfeldt Center. It's called Photodynamic Therapy, and it's actually then using light in order to be able to turn on mitochondria in the body, reduce inflammation, also kill off pathogens like viruses, bacteria, fungus, parasites, also cancer cells. It's been heavily researched how photodynamic therapy is very effective in killing cancer cells. One of the issues has been being able to then penetrate deeper into the body and being able to use photodynamic therapy at more of an internal level rather than just superficial. It's been mostly just things like melanoma, skin cancers, where you apply a photosensitizer and then apply light onto that tissue. And photosensitizer is something that absorbs into the tumor more heavily, then it draws light to itself to increase the energy within the tumor to kill off the cancer cells. So that process has evolved, and this is the evolution right here, is where we can then actually treat the bloodstream, using photodynamic therapy, but we can also then go after tissue that is deeper in the body and then deliver enough light into that body using laser light, which is a much more powerful form than just a simple LED. So we can penetrate deeper and then trigger then that oxidative reaction, a creation of reactive oxygen species, then to kill off cancer cells. So this is what a machine looks like. And I'm just going to kind of show you. This machine then delivers several different colors, like you see here. Here you have then the red color right here. And so you can see that on the hand right there, the red. So when you introduce that then intravenously, you will then actually, as the blood passes by, it will be treated by this light. It becomes in a very sterile environment, and the blood will pass by this location about once every minute. So in a 60-minute session, you'll be able then to treat your blood 60 times, your whole blood volume 60 times. So you get red, and I'll talk a little bit about the effects and what it does. And then you have other colors, and these are just ones that I kind of wanted you to visually see. Like here, we got green, see the green right here. So same way, introduce that intravenously, and you would use a needle like this, and you would couple that onto the laser cord, and that light would then travel into the needle. It's a fiber optic needle, and then it will then treat the blood as it's passing by. And then you have the blue right here. So just blue right there, blue right here. And so the same, it will treat then the blood as it's passing by. So you can do this intravenously, or let's say you have a tumor-specific site. You can then introduce that, put the needle, and then kind of surround the tumor with these laser needles, optic needles, and then get a lot of light into that tumor in addition to, and you prepare it then with photosensitizer. So there's be a high concentration of energy from that light. So this is what the machine looks like. And so the different colors, red really activates the immune system. Then the green is more kind of a balancing, for cardiovascular. The red blood cells, they absorb a lot of green, so it helps to energize the red blood cells a lot. The blue it kills off bacteria, viruses, kills off a lot of things. Just the blue light in itself, you can make that even more powerful by combining it with a photosensitizer like riboflavin, would make it even more powerful. So because then the riboflavin, which is just vitamin B2, will then attach itself to the pathogens. And then as the pathogens are flowing by in the arm, when we have the needle there, they get all that juice, all that energy that actually kills them off. So that's a very powerful way to clear off a lot of pathogens, and can do the same, because one of the issues are circulating tumor cells. And we know we don't want those because they can go places and they can do things that we don't want. So by treating the bloodstream, you're then able to treat what is flowing by. And then also, as you treat those circulating tumor cells, they will then break up into small pieces. And then as the immune system will see these small pieces, it can then mount then a specific antibody response to those small pieces. And so now we've educated the immune system in regards to what the components are of those circulating tumor cells, so that they can be very specific and very targeted in the antibody response against those circulating tumor cells that came from the cancer, from the tumor. So it will be more efficient in going after that. So that's a beauty with using photodynamic therapy, is that in addition to the direct kill, it also educates the immune system in regards to, how to address this more efficiently. It makes it more intelligent. And there are other effects as well that comes along with it. It has a strong, what's called an anti-angiogenic. So it kind of kills off the vasculature, the blood vessels that feeds a tumor, so that a tumor is not very efficient in its usage of energy. So it requires a lot of resources. And that's why you see a huge amount of blood supply feeding that tumor. And by then killing off that blood supply, the tumor becomes very vulnerable, because it is so inefficient. And now as you kill off the blood vessels, it doesn't get what it needs. So then it starves and then dies. Or we can then push it even harder with other oxidative therapy. If an individual does chemo, or this type of therapy, or high dose vitamin C, or other type of oxidative type of therapies, it will be much more vulnerable, and we can go after it much more strongly. So in addition to then, we talked about photosensitizers. So we have then the red light. There are certain photosensitizers that are associated with it, because there's certain chemicals that absorbs that light better than others, is frequency. Like, for instance, chlorophyll absorbs a lot of red light. And you also have like methylene blue is something that's used quite a bit. And then for infrared, and if I would turn it on, you wouldn't see it anyway, so I'm not going to turn it on. But it's part of the machine. And beauty with infrared is that it has a longer wavelength, so it penetrates much deeper. And also one of the most powerful photosensitizers, the non-ionized version of ICG, which is helps to kind of, because it's non-ionized in a liposomal form, it accumulates in the tumor, and then it stays in there for a longer period of time, which allows a longer treatment period to be able to go after it. And so by using the ICG, the non-ionized version of ICG, and then couple that with infrared, which is one of these diodes here, then you're able then to create all that juice to kill off then the cancer cell. And then the blue light, there are a lot of, so we talked about the riboflavin, but vitamin C, for instance, curcumin, all of them are photosensitizers for the blue light. So if, for instance, you were going to do a curcumin IV, which is one of the things that we do, you can do the curcumin IV and then follow up that with blue light. And then the curcumin will function as a photosensitizer. And then you have the effect then just kind of using the blue light here. So this is what it looks like. And as I mentioned, you can do this intravenously. You can do that directly on site, depending on where the tumor is. And you can also do that externally. So you can have then a shower head with powerful laser that penetrate deeper than into the tissue to support the body to kill cancer cells off. And then the good thing is that it becomes very targeted, so it doesn't destroy healthy cells. In fact, the healthy cells actually benefit from it. For these different colors, turns on the energy production within the cell, the mitochondria. Within the mitochondria have something that's called TC, electron transport chain. And so as electrons are moving through there are different substations called complex 1, 2, 3, 4. And each color will help to support these different stations to move those electrons across to increase the energy within healthy cells, to make them more resistant to cancer, and also able to detoxify better and regenerate better. So Just want to get a kind of a feeling for what it looks like, because I talk a lot about this during all the different conferences and summits that I do. So yeah, hope you appreciated this.